Bismillahirrahmanirrahim, dear viewers, Assalamu alaikum. थोरेसिक स्पाइन लेक्चर सीरीज का लेक्चर 1 जिसमें हम आपसे डिस्कस करेंगे जनरल डिस्क्रिप्शन एंड फंक्शन ऑफ द thoracic spine. Introduction in structured detail of the thoracic spine and rib cage. Thoracic spine को हम इसमें विदाउट रिब केज नहीं ले सकते क्योंकि ये thoracic spine पूरा एक thorax अगर हम ले तो तभी उसकी समझ आ जाती है। और ये एक यूनिक रीजन है स्पाइन बॉडी की कि जिसमें मोबिलिटी रिस्ट्रिक्टेड है और उसकी भी एक बहुत अहम वजह है। और अल्लाह ताला ने इसका जो स्ट्रक्चर बनाया है वो ऐसा है कि जो हमारे बहुत ही यानी अहम विसराज है उसके प्रोटेक्शन के लिए ये स्ट्रक्चर जो है बनाया गया है और इतने खूबसूरती से कि वो प्रोटेक्शन भी है और उसको फंक्शनलिटी के लिए भी फुल एक इन्वायरमेंट जो है उसमें अवेलेबल है। अगर thoracic spine की ओवरव्यू पे हम जाए तो located in the mid back, the thoracic spine consists of 12 vertebrae T1 to T12. It has a natural kyphotic curve, outward curve that supports posture. Each thoracic vertebra connects to a pair of rib from the rib cage. The rib cage works with the thoracic spine to allow breathing and protecting internal organs. Rib cage overview की बात करें, the rib cage protects vital organs like the heart and lungs. It consists of 12 pairs of ribs. Ribs 1 to 7 called true ribs are directly attached to the sternum, and ribs 8 to 10 false ribs attached indirectly, and rib 11 to 12 called floating ribs not attached to the sternum. Cervicothoracic junction. The cervicothoracic junction anatomically comprises the C1, the C7 to T1 segment and functionally includes the 7 cervical vertebra, the first 2 thoracic vertebra T1 to T2, the first and second ribs, the manubrium. The bone mass of the vertebral body is increased cranially to caudally, particularly in the lower levels. Age-related changes in the thoracic vertebra. Progressive wedging of the thoracic vertebra bodies occur with the increasing age. Disc space narrowing is common and usually starts at multiple levels from the third decade of life around age 30. These changes can contribute to increased kyphosis and reduce spinal flexibility over time. Intervertebral disc. The intervertebral disc of this region are narrower and flatter than those in the cervical and lumbar spine and contribute approximately 1/6 of the length of the thoracic column. Disc size in the thoracic region gradually increases from superior to inferior. The disc height to body height ratio is 1:5 compared to 2:5 in the cervical spine and 1:3 in the lumbar spine. In the thoracic spine, the segmental nerve roots are situated mainly behind the inferior posterior aspect of the superior vertebral body rather than behind the disc, which reduces the possibility of root compression and impairments of the thoracic disc. T-spine intervertebral herniation. In a review of 280 patients, Orson Dorman found that thoracic disc herniation constitute 0.25 to 0.75% of all disc herniation. Because the intervertebral foramina are quite large, at these levels, osseous contact with the nerve root is seldom encountered in the thoracic spine. The dermatomes in this region have a fair amount of overlap. They cannot be relied upon to determine the specific nerve root involved. At the level of T49, the canal is at its narrowest. Central disc protrusion. Central disc protrusion are more common in the thoracic region than in other region of the spine, and because the nucleus pulposus is small in the thorax, protrusion are invariably of the annular type and nuclear protrusion are rare. Complicating matter is the fact that this is an area for vascular supply, receiving its blood from only one radicular artery. This renders the thoracic spine cord extremely vulnerable to damage by extradural masses or by an overzealous manipulation. Typical thoracic vertebra from T2 to T8 shape, heart-shaped body, facet, two costal facets on each side of the rib. ये जो इनकी वो है thoracic vertebrae की डिटेल है, ये typical और नॉन टिपिकल टिपिकल और अटिपिकल में डिवाइड करते हैं और इनकी चंद सिमिलरिटीज है जिसकी बेस पे ये क्लासिफिकेशन है. एटिपिकल फ्रॉम T1 to T9 and T12, ये एटिपिकल है सारे और इन सब की जो है डिटेल यहाँ पे लिस्टेड है. Complexity of the spine. T2 to T9 vertebra have synovial joints with the ribs, costovertebral plus costo or transverse joints. Each thoracic vertebra typically articulates with the rib above and below through 8 synovial joints. 2 synchondroses refer to cartilaginous joint where ribs connect to the sternum. 11 joints per segment. 8 synovial, 2 synchondroses, and 1 additional joint, sternal or interchondral. Sternomandibular and interchondral joints added 13 synovial joints. The second rib has 9 joints because it articulates differently with the sternum and mandibular. When multiplied, 11 joints and 10 segments, total joints 110 joints in the thorax. So it's a very complexity in this area, too many joints. Thoracic spine, rib cage and function. ये तो उसकी डिटेल थी कि कितने उसमें मोहरे है, कितनी उसमें डिस्क्स है, डिस्क की क्या स्पेसिफिकेशन है और मोहरों की क्या स्पेसिफिकेशन है और नर्व्स कहाँ से निकलते हैं और उसमें इम्पेंजमेंट क्यों नहीं होती कि लार्ज फोरामिना होता है और नर्व जो है वो ऑसियस स्ट्रक्चर के साथ कांटेक्ट में नहीं आता. तो ये हमने ये भी आपसे जिक्र किया था कि thoracic spine की फंक्शन और rib cage, thoracic spine and rib cage की collective function जो है it's very very important. तो protects vital organs. It helps from the rib cage, shielding the heart, lungs and more and major blood vessels. Support postures. Its natural curve helps keep the body upright and balanced, allows movement. Though limited, it still allows rotation, bending, and some flexing of the upper body. Anchors muscle. Many important muscles are for breathing, moving, and stabilizing the body are attached to the thoracic spine. Transmits forces. It helps distribute forces and loads between the neck and lower back during activities like lifting or running. So ये description था जो मैंने शेयर किया आपसे thoracic spine की और thorax की overall function and osseous structure की डिस्क्रिप्शन. नेक्स्ट में इंशाल्लाह उसकी कंप्लीट बायोमैकेनिक्स आपसे डिस्कस करेंगे. थैंक यू.